Hello and welcome. Today we're going to be talking about the ABCs of CPR. To begin with the question, would you know what to do if an individual near you went down and needed immediate medical attention? Well, today I hope to inform you of why CPR is important. To begin to help you understand the basics of CPR, we're going to talk a little bit about the history, how it developed and how it came to. We're going to talk about how to administer it, when and why. We're going to talk about CPR as well as the administration and how to properly do it, and the certification that goes involved within CPR. As a good friend of mine, Joseph Mistovich, the professor at YSU in Allied Health as far as pre-hospital care goes, likes to say, it all makes sense. But what he means by this is, in the end, after fully understanding it, it truly does all make sense. So, Peter Safar and James Elam were the founding fathers of the artificial ventilation, which is mouth-to-mouth as we know today, or mouth-to-mask. Before they invented the mouth-to-mask resuscitation, there was no actual hands-on CPR. Studies recently showed back then that they took 50 volunteers and they used a paralyzing agent and actually paralyzed them and ventilated them via mouth-to-mask to prove that the studies were actually positive. The use of the fire departments helped spread across the CPR and its advantages and how it helped pre-hospital care. Open doors for treatments and advancements in allied and pre-hospital care, as far as the technology goes within using the proper placement of CPR, proper compression to venting ratio, and defib as far as electrical therapy goes. A quote from Heisenberg once said, 100 years ago, an individual that suffered from cardiac arrest or drowning didn't stand a chance at all of surviving. Well, nowadays, with the professional and ambulance care that we have in pre-hospital care with immediate response, the individual in that situation stand a much better chance of survival. In the past, in the history, the way they went about opening up the airways and giving ventilations, as you see they did different hand and arm placements, padding underneath the back to put the head in neutral position to allow air flow into the lungs. Nowadays you see that we do defib as well as electrical therapy, hands-on chest compressions, and we do a head tilt chin lift or a jaw thrust on a traumatic patient to open up the airway to allow ventilations and oxygen within the lungs. As well as the new developments in the chain of survival goes, here we have early recognition, being able to see the individual go down and understanding why and why this happened. CPR immediately after we witness this is important, as well as phoning 911 as well. Defib and electrical therapy is very important as far as survival chances go, in getting advanced life support on scene as quick as possible to administer ACLS cardiac drugs. So, physiological symptoms, we see that an individual went down and has become unresponsive. We're going to check for a pulse. If no pulse is noted, we're going to move to the airway. Look, listen, and feel. Looking for chest rise, feeling for any air movement. If none of these are noted, we're going to begin CPR. Artificial ventilations are exactly as it sounds. If an individual is not breathing on his own, we're going to breathe for him via mouth-to-mouth, creating a good mouth seal and giving 2 rescue breaths. As far as artificial compressions go, we're going to do good, proper hand placement. 2 fingers on the xiphoid process. We'll place our hand right above that, the palm, interlacing our fingers lifting up on our hand so we have just the palm of our hand on the chest. With that, we're going to conduct 30 compressions and then 2 rescue breaths. After that, and when an AED arrives on scene, we can go ahead and defib. With technology nowadays with LifePaks we have, it allows us to analyze the rhythm. And it gives us the okay if shock is advised or is not. Here we have what's called ventricular fibrillation, which is a shock rhythm, and a normal sinus, which is a good perfusing rhythm. The how to administer CPR is what we talked about. Before, again, checking, we want to see if if they're breathing on their own, if they have a pulse, if the ventilation is adequate. And this is going to change on the type of patient that we're looking at. If we have an adult versus a pediatric versus an infant. Kids are not small adults. This is going to change the depth as well as the compression scale, the ratio on if it's 1 or 2 healthcare providers. Now, in the beginning, it was ABC's airway breathing and circulation. Nowadays, they've shown that compressions is more important than breathing the airway. So they have changed it to compressions, airway, and breathing. 30 compressions to 2 breaths is what's efficient. When we do this 5 times, it's going to be 1 cycle. Proper placement, what we speak about, is the good hand placement on the chest in the proper location. Using your upper body weight, keeping your arms straight so you're not going to get fatigued and tired out. The speed of compressions is about 1 a second, giving you 100 or 60 in a minute. Doing this to the beat, Staying Alive, or another one, Bites the Dust. If you sing that song to yourself, it'll help you stay on tact when doing compressions. Improper administration. Don't be these 2 individuals. If someone's obviously sustained an injury that's incompatible with life, there's no sense in trying to resuscitate. As much as we'd like to try, it's not going to happen. You end up doing more harm than good. Don't be doing compressions on the abdominal. It's not successful. So as long as the neck, it's not going to help. Become CPR certified. The reason why you would want to become CPR certified is it covers yourself from any civil liability. That and it gives you the proper knowledge behind what's involved. Now, where you can find classes, you can go online to the AHA, American Heart Association, and look at classes online. They range from about $20 to $30 a class. The length of class is going to be anywhere from 2 to 4 hours, depending on who's teaching and instructing it. Or you can go to your local Red Cross and get classes usually free of charge. What's going to be going on in the classes is going to be a lot of hands-on activities. You'll have mannequins, there'll be a written test at the end, and you'll have to be tested out on the mannequin. Then you will receive your certification. According to American Heart Association, 1 in 3 adults suffer from some type of cardiac disease, which puts them at a much higher chance of going into cardiac arrest, thus requiring CPR to stabilize them and by its timing to advance life support gets on scene to get them in the hospital. Well, I hope that you are able to take something home from this and understand why CPR is important. I hope that you can answer my question now. If someone around you goes into cardiac arrest or suffers from some type of disease, that you will be able to help perform a task. Thank you.